Why is dementia, Alzheimer's, and other mental health disorders increasing? Are they preventable? Mental health is an integral part of our overall well-being, affecting how we think, feel, and act. It influences our ability to handle stress, relate to others, and make choices. Despite its importance, mental health is often overlooked or stigmatized. Liam's story sheds light on the realities of living with a mental disorder and highlights the importance of understanding, recognizing, and addressing mental health issues. At 30 years old, Liam was a successful professional with a promising career. However, he began experiencing persistent feelings of sadness, loss of interest in activities he once enjoyed, and a pervasive sense of hopelessness. Initially attributing these feelings to work stress, he soon realized that he was grappling with something more profound: depression. Liam's journey toward recovery underscores the significance of mental health awareness and the impact mental disorders can have on every aspect of life. Types of mental disorders. Mental disorders encompass a wide range of conditions that affect mood, thinking, and behavior. Some common types include 1. Depressive disorders, which is characterized by persistent feelings of sadness, hopelessness, and a lack of interest in activities. This category includes major depressive disorder, which Liam was diagnosed with. 2. Anxiety disorders. This involves excessive fear or anxiety. Examples are generalized anxiety disorder, panic disorder, and phobias. 3. Bipolar disorder. This is marked by alternating periods of depression and mania, elevated mood, energy, and activity levels. 4. Schizophrenia and psychotic disorders. These are characterized by distorted thinking, perceptions, emotions, and behavior, often including hallucinations or delusions. 5. Personality disorders. These involve enduring patterns of behavior, cognition, and inner experience that deviate markedly from cultural expectations. 6. Eating disorders, such as anorexia nervosa and bulimia nervosa, involve extreme emotions and behaviors surrounding weight and food. 7. Obsessive-compulsive disorder, OCD, is characterized by unwanted intrusive thoughts, such as obsessions, and repetitive behaviors, such as compulsions. 8. Post-traumatic stress disorder, PTSD. It develops after exposure to a traumatic event, leading to flashbacks, nightmares, and severe anxiety. Epidemiology. Mental disorders are prevalent globally and can affect anyone regardless of age, gender, or socioeconomic status. According to the World Health Organization, 1 in 4 people will be affected by a mental disorder at some point in their lives. Over 264 million people worldwide suffer from depression. It's a leading cause of disability globally. Anxiety disorders are estimated to affect 284 million people, making them the most prevalent mental health disorder. Half of all mental health conditions start by age 14, but most cases go undetected and untreated. Close to 800,000 people die due to suicide every year, making it the second leading cause of death among 15 to 29-year-olds. Causes of mental disorders. Mental disorders result from a complex interplay of various factors. Biological factors include genetics, where family history can increase susceptibility, and brain chemistry, as imbalances in neurotransmitters can affect mood and behavior. Chronic illnesses can also contribute to mental health issues. Psychological factors such as trauma from emotional, physical, or sexual abuse can lead to mental disorders. Grieving the death of a loved one can trigger depression or anxiety, and prolonged stress can impact mental health. Environmental factors include socioeconomic status, as poverty and financial instability can increase risk, and social isolation, where a lack of support networks can exacerbate mental health issues. Cultural factors like stigma and discrimination can prevent individuals from seeking help. Lastly, substance abuse involving alcohol and drugs can both cause and result from mental health disorders. Impact on both sexes. Mental disorders affect both men and women, but there are differences in prevalence and expression. Women are more likely to experience depression, potentially due to hormonal factors, while men are less likely to seek help and may exhibit irritability or anger rather than sadness. Anxiety disorders are generally more prevalent in women. Substance abuse has higher rates in men and often co-occurs with other mental health issues. When it comes to suicide, men have higher rates of completed suicide, whereas women have higher rates of suicide attempts. Societal norms and cultural expectations can influence how symptoms are expressed and addressed. Early detection and intervention are crucial for effective management. Recognizing symptoms is the first step. Liam noticed persistent sadness, fatigue, and a loss of interest. These are key signs of depression. A medical evaluation is the next step. This often starts with a physical exam to rule out any medical conditions. Then laboratory tests might be done to check for underlying issues like thyroid problems. A psychiatric assessment is also essential. This involves clinical interviews to discuss symptoms, thoughts, feelings, and behavior patterns. Diagnostic criteria from the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, are used for an accurate diagnosis. Self-assessment tools like questionnaires can also help identify the severity of symptoms. Prevention strategies. While not all mental disorders are preventable, certain strategies can reduce risk. 1. Education and awareness. 2. Mental health literacy. Understanding signs and symptoms promotes early help seeking. 3. Stigma reduction, encouraging open conversations about mental health. 4. Stress management. 5. Mindfulness and relaxation techniques, that is, meditation and deep breathing exercises. 6. Time management, by prioritizing tasks to reduce overwhelming oneself. 7. Healthy lifestyle. 8. Regular exercise, boosts mood and reduces anxiety. 9. Balanced diet. Nutrient-rich foods support brain health. 10. Adequate sleep, essential for emotional regulation, social support. 11. Building relationships. Strong connections can provide emotional support. 12. Community engagement, involvement in group activities. 13. Early intervention. 14. Seeking help promptly. Early treatment can prevent conditions from worsening. Treatment options. Effective treatment often involves a combination of approaches. 1. Psychotherapy. Cognitive behavioral therapy, CBT, helps identify and change negative thought patterns. 2. Interpersonal therapy, IPT, focuses on improving relationships and communication. 3. Psychodynamic therapy explores unconscious patterns influencing behavior. 4. Medication. A. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, for depression. B. Anxiolytics are indicated for anxiety disorders. C. Mood stabilizers are used in bipolar disorder. 5. Lifestyle modifications, such as starting an exercise program, that is, regular physical activity, can alleviate symptoms. Nutrition counseling, ensuring a diet that supports mental health. Support groups, these include the following. 1. Peer support, that is, sharing experiences with others facing similar challenges. 2. Family therapy. This involves including loved ones in the treatment process. 3. Alternative therapies. This involves art and music therapy, which are creative outlets for expression. 4. Mindfulness-based stress reduction, MBSR. This combines mindfulness meditation and exercises. 5. Hospitalization. The affected person is hospitalized and given inpatient care, especially for severe cases requiring close monitoring. Liam's path to recovery. Liam's journey involved multiple steps toward regaining his mental health. First was acknowledging the problem. Realizing that his feelings were more than temporary stress prompted him to seek help, professional help. Second was consultation. He met with a mental health professional who diagnosed him with major depressive disorder. Thirdly, he was given therapy. He began weekly CBT sessions to address negative thought patterns. He was also placed on medication, including antidepressants, which were prescribed to help balance his brain chemistry. He was also placed under monitoring, which involved regular follow-ups to assess his treatment's efficacy and adjust the dosage. Liam then adjusted his lifestyle and started exercising. He started a routine of daily walks, which improved his mood, and also adopted a balanced diet rich in omega-3 fatty acids and antioxidants. He also adopted sleep hygiene by establishing a regular sleep schedule and started building a support network where he had open communication and shared his struggles with close friends and family. He then joined a local depression support group, practiced mindfulness and relaxation techniques to reduce stress, and re-engaged with photography, a passion he had neglected. As part of his therapy, he was advised and guided to setting realistic goals through gradual, incremental progress. He focused on small, achievable steps to build confidence and avoid stress. Over time, Liam experienced significant improvements. His energy levels increased, and he regained interest in his hobbies and social activities. While recovery was not linear and setbacks occurred, he learned coping strategies to manage his symptoms effectively. Conclusion. Liam's experience highlights the profound impact mental disorders can have on an individual's life and the importance of recognizing and addressing mental health issues. Mental disorders are common and can affect anyone, but with appropriate treatment and support, individuals can lead fulfilling lives. Awareness, education, and open dialogue are essential in breaking down stigma and encouraging those affected to seek help. By understanding the types, causes, and treatments of mental disorders, we can promote mental well-being and support those on their journey to recovery.